perform my hand hygiene, and I'm going to check my medications that are ordered for my meningitis patient, Addie. She has acetaminophen, and we're going to give 20.4 mLs. I don't know if they're going to be able to see this. 20. Can you see it? 20.
Yeah, I can see it.
Can you see it? Okay. So 20. And then we're going to draw up 1.9 milliliters of Toradol. And then we would have Rocephin too, and that's going to be in an IV, so our RN is going to have to draw that up. Of Toradol. Is it okay?
Can't really see the numbers. Okay, they should be able to see that then, I would think. Okay.
Okay. Alright, so we've got those set up. And then, do we make another video or do we just go into it?
I think we do the med push at the end of our skills.
Yeah.
So.
Okay. Alright, so then I'm going to perform my hand hygiene. I'm going to put on my PPE, my proper PPE. I'm going to as I come into the room, I'm going to notice the general appearance of my patient, how they are looking, how they interact with their parents, how they adjust when I come into the room, and I'm going to notice their range of motion as they move into in their bed.
I'm gonna move around to the
Okay,
other side. I feel like it's a better position.
Yeah. All right, so I've got on my gloves, my PPE, I washed my hands. So I'm going to come to my patient and I'm going to ask her to identify herself with her name and date of birth. I'm going to check her bracelet as she does this. My patient's name is Addie. She is 16. Yep, 16-year-old Addie. Okay. Addie I would have Addie tell me what day it is and who else is in the room with us. Mom and Dad are here. And so I'm going to say that Addie is alert and oriented to us. I'm going to ask Addie about her pain. Addie has stated that she's a 10 out of 10, so I would have used the number scale to identify that. And I'm going to explain what I want to do. I want to do a head-to-toe assessment with Addie, and I want you guys to ask me any questions if you have any throughout any part of the procedure. And I want to get a set of vitals to start. So I would put on her blood pressure cuff right here, and her blood pressure is 146/72. So Addie's got a high blood pressure, and I think that is due to her high pain. And I'm going to check her temperature, and that comes in at 39.5. So she's got a good fever, and we're gonna give her some medication to help with that. Then we're going to, I would have shut the door and provided privacy before I started all of this. And I'm going to try and keep the lights dim throughout this as much as I can, and I'm going to talk with a lower voice with my patient because that hurts her head. Addie is at bed rest, so I would get her height and weight while she's laying down in bed. I'm going to check her pupils, and I'm going to tell her that this is going to be a little uncomfortable for her because her head hurts so much. So I would check 1 and 2, and then I'm going to have her follow my finger back and forth, and then I'm going to come in. So Addie's pupils are equal, round, and reactive to light. Addie weighs 125 pounds and she is 68 inches tall from our bed weight and height measurement. I'm going to listen to Addie's respirations in 12 different places, all the way down, and her breath sounds are normal. I sound so weird with that. I'm going to check her skin as I'm going along doing her skin assessment. As Addie is talking to me, I'm going to notice her psychosocial, how she's interacting with me, how she's interacting with mom and dad. And as she's talking to me, I'm noticing her mucous membranes too. Her respirations are normal, in a normal range. I don't think this is on paper, but I would put her respirations at 16 because that's in a normal limit. So I'm going to listen to her heart in the 5 different places. And her heart sounds are normal, and her heart rate is in a normal range too at 85. So I'm going to, as I'm doing this, I'm looking at her chest, and she has a dark, deep purple rash all over her body, and that is consistent with meningitis. So after that, I'm going to check Addie's pulses bilaterally on her radial pulses, and I'm going to have her squeeze my fingers, and she does a good job with that. I'm going to come over here and come down, and I'm going to check Addie's pedal pulses. I'm checking her capillary refills on both sides. I'm going to have Addie push on my hands, and I'm checking for signs of edema, any signs of diaphoresis, and she has a rash all over her legs too. I'm not noticing, I haven't seen any other signs of contusions or abrasions. And I'm going to, as I'm checking her pulses, I'm going to look at her IV that's not hooked up, but it would be in her hand over here, and that's going to be for one of her medications and IV maintenance. She's getting D5 half normal saline with potassium chloride at maintenance. So I'm going to come back up here, and I'm going to assess Addie's abdomen. I'm going to look for any signs of distension, and I'm going to ask Addie if she's had any nausea or vomiting or any pain associated with her stomach. I'm going to listen to her abdomen in the 4 quadrants. Before I palpate it, I'm going to ask if she has had any problems with bowel movements or in the last time she had a bowel movement. And Addie's stomach is soft and non-tender in all 4 quadrants. I'm going to ask Addie if she has had trouble urinating, if it has burning or frequency, the color, and she states that she has no problems with any of that. I'm going to look at Addie's peri area to make sure that there are no signs of trauma. She's still got a rash. There's no abrasions or contusions. And then I'm going to have Addie roll over if it's not too uncomfortable, and I'm going to listen to her breath sounds on her back. She has no signs of skin breakdown that I have noticed through my assessment, and her rash is still on her back. So then we're going to talk about her medications. So she's going to get 3 different types of medication. Rocephin is an IV push, so that is going to come from the RN when she comes in to do that. Side effects of Rocephin are a rash, an allergic reaction, swelling, redness, pain at the injection site. We need to check for phlebitis before we do that. And we need to make sure the IV is in proper placement. I can't remember the word. As I'm going through this, I need to notice Addie's respiratory and how she is breathing, like to make sure she's not having difficulties with it, and make sure she's not, what is the word? Struggling to breathe, I guess is that. Okay, so Addie's going to get a Toradol shot. It is going to be an IM injection with a 1-inch needle. It's going to go right here in her vastus lateralis. Side effects that you guys need to know about are indigestion, diarrhea, drowsiness, headache, and reaction at the site of injection. She's going to get 1.9 milliliters, and it can be in 1 shot. Then we're going to have Tylenol. And so I would set Addie up. I'm going to set her up, and I'm going to have to make sure that she is okay to drink this Tylenol. 20.4 milliliters. She needs to know that, Mom and Dad need to know that it can cause liver toxicity if she has over 5 doses. It can cause nausea, stomach pain, and rash. And then as soon as she would drink that, I would lower her back down. So it's taking pressure off of her neck and her head. And before I would give those to her, I would check her 6 rights. I would do right patient, right time, right dose, right medication, right route, and right documentation, which I'll do afterwards. And then I do this. I give it to her, right? So, do you want me to just turn right here so you can see it? So I'm going to clean the site of injection. Around. And then I'm just going to I'm going to put a Band-Aid on it for Miss Addie. This is going to go right into Sharp's container that I don't have. Here. And I would lower Addie back down, ask if they have any questions. That's it. I'm going to wash my hands and I'm going to document everything.